So our next presenter is going to be Stephanie Jerstad. She's got her Ph.D. in Criminology and is also the assistant professor at Millersville University in Pennsylvania. She is here to talk about policies and addressing our aging loved ones. As we all know, this is kind of hits close to me because in Florida we have no good anywhere for anybody to go on the registry when they start to get older, need help, or even rehabilitative care. I mean, I had a mini stroke at 30, and they were talking about, oh, you might have to go to rehab. I'm like, well, fuck, where am I going to go? Because most places won't take you. So this is something really close to me, and I think should be a great presenter. Thank you.
Thank you. If you do want to follow along with my PowerPoint presentation, you can go to, John uploaded it for me, but if you go to parsol.org/SJ, you can find my PowerPoint presentation and follow along, or if you wanted to refer to it after I'm done speaking, I'm assuming it'll be up there for a while, right, John? Thank you. Yeah, okay, good. All right, wonderful. Well, it's so good to be here and meet new people and then reconnect with all the people that I get to enjoy working alongside every year. So today's conversation, though, is really about policies addressing long-term care facilities, their inability or their unwillingness, really is what it is, to admit someone with a prior sexual harm conviction, or those that are forced to register. And the reason why I kind of made this a passion of mine was in 2016. Maybe I could take this off. Can I take this off? I'm a professor. I like to move around the room a little bit. But then that might mess you up if you're recording. So, okay. In 2016, I had a master's degree. I was a case manager. I was working with the Department of Veteran Affairs. I was a homeless case manager working with veterans who were without permanent shelter. I had a gentleman on my caseload. His name was John, and John was 76 years old, and we had found him permanent housing, and then John got sick, and he needed to be in the hospital, and he was in the hospital for about 30 days, and at that point, he was needing to go into a skilled nursing facility. So we were wondering what that looked like. Where was he going to go? He really wanted to be in Illinois. We were in Indiana at the time, but his family was in Illinois. So between myself and the hospital social worker, another VA homeless case manager, we called 212 facilities in the state of Illinois, and no one would accept him because of his registry status. John ended up dying before I could ever get him into a skilled nursing facility. So I was pretty outraged. Quite frankly, I was pretty pissed off about that. I grew up working in the medical field before I made a transition into criminology and criminal justice, and I just thought that everybody had access to health care, and everybody should have access to health care. So John died, and I thought to myself, how many other Johns are there in the United States, or Johnettes in the United States, that this is happening to? So in 2017, I left my position and headed off to Illinois to get my PhD at Southern Illinois University. And when you're getting your PhD, you're kind of tasked with coming up with a dissertation topic, like what's going to be your research, what's going to be your thing. And I thought of John immediately, and I thought, how many of these stories are out there? And so my dissertation is about the willingness of long-term care facilities to admit someone who has a prior sexual harm conviction. And so being in Illinois, I started with Illinois. And so it became clear to me in the last 10 years that the struggle for many of the aging offender population convicted of a sexual harm offense is very evident across the country. So I found that 12 states actually have laws and policies and procedures addressing the admission and management processes for individuals with a sexual harm conviction that are seeking to, needing residency in a long-term care facility. But really what we don't know is the extent to which how many individuals this affects across the country. So if we think about it anecdotally, and we can hypothesize that 11% of those that are forced to register over the age of 65, 70% of them will need some form of skilled nursing care. So may not necessarily be in a nursing home facility, but it could be some level of skilled care. So if we take that, so I was doing math actually while Janice was talking. Yes. So if we take the 850,000 individuals that are forced to register, 11% of them being over the age of 65, that's 93,500. And then if we take that 70% of them will require some level of long-term care, that's 65,450. And that's as of today, as it stands. So potentially there are 65,450 Johns in the United States. So as we all know, we talked about it, and Janice and Amber both talked about like taking away the term recidivism, because it is defined differently in every state, and most of the time it is based on technical violations and not reoffending rates. We know that as people age, it's less likely that they'll reoffend. However, long-term care facilities base many of their admission decisions based on the myths, the attitudes and perceptions that we have of those convicted of a sexual harm conviction. Okay, so housing, as a homeless case manager, a lot of my research is related to housing. People don't think of long-term care facility, or they probably just don't think of it as another form of housing, right? Another form of residence. So housing is a significant restriction for those living with a sexual harm conviction. And because of residency restrictions, individuals face surmountable challenges in the acquisition of approved, safe, and secure and permanent housing. So again, one of the areas of housing that isn't commonly discussed is the ability of individuals to secure non-traditional housing like nursing home care. And so I really wanted to know, like, how will this affect our future housing outcomes? So because of John's story, made me ask a lot of questions, and I wanted to know, was this really isolated to long-term care facilities in Illinois? Illinois does have a long-term care facility legislation. It's called the Illinois Nursing Home Care Act. It was established in 2005. Originally, it was established to actually keep nursing home residents protected from actual employees and staff. So that was the original intent of the Illinois Nursing Home Care Act. And then somebody had to insert the conversation of, well, if we're going to protect them from employees, how do we protect them from other residents that are forced to register with a prior sexual harm conviction? So that's where that came up. So I wanted to know, how many states have legislation like Illinois? Does legislation even really matter? Are there unique characteristics of states that may cause them to draft some legislation? Or is it just characteristics of a facility that may admit or deny someone that is forced to register? And really, I wanted to know about the attitudes and perceptions of long-term care facility administrators and how that might actually play a role in making admission decisions or admission exceptions. So, since we can't see this slide, I want to tell you the states that actually have long-term care facility statutes. California, In Florida, they do not have a state long-term care facility legislation, but there's pockets in Illinois or in Florida that actually have policies related to long-term care. Idaho, Illinois, Louisiana, Massachusetts, Minnesota, North Dakota, Ohio, Oklahoma, Oregon, Texas, and Virginia. So there's 12 states that have policies on the admission and management processes of people forced to register or those that have a prior sexual harm conviction. Good news, bad news, the legislation was actually drafted and put into place between the years of 2005 and 2010. So no such legislation has been passed in the last 14 years, but does it really matter? And we'll get to that. So looking at legislation, I wanted to see what is the language of the legislation? I did a content analysis. I know this is research talk, but did a content analysis of the language of the law. And I wanted to see what are all the similarities in the language of the law, or are there differences? And I wanted to just really look at what words are they using? What are they saying? What's introduced into the language? And a lot of the language that they use in the long-term care facility legislation really mirrors our Jacob Wetterling Act, our Megan's Law, our Adam Walsh Act. So a lot of it has to do with notification, language that discusses disclosure of status, requirements that they have to use the registry as a screening tool for their admission decisions. Residency restrictions were inserted into the language of the law. And then lastly, they use some individualized care plans, and some of them even supervise and segregate if they do admit someone that is on the registry or with a prior offense. Let's see. So looking at state characteristics. States are very punitive, some punitive more than others. Those of you that are familiar with Florida, Florida's probably our most punitive state. Not just criminal justice response to those with a prior sexual harm conviction, but just criminal justice responses. And I wanted to find out, does population matter? Does crime rate matter? Criminal justice responsibilities, or do sex offender policies matter? And what I found out is that states that have residency restriction legislation are 14 times more likely to have a policy that does not allow or easily permit those that are forced to register into nursing homes. States that have civil commitment laws are 10 times more likely to have a long-term care facility legislation. So it obviously makes it very difficult when we have states that are already restricting movements of those that have a prior sexual harm conviction or who are forced to register, even have access to long-term care and medical treatment. Let's see. So you can't see this table, but so we have, of the 12 states that have long-term care sex offender law, 9 of those have civil commitment laws, and 10 of those also have residency restrictions. So when looking at facility characteristics, what might make a long-term care facility admit someone or not admit someone? And what I found is that long-term care facilities who are not for profit are more likely to admit someone that is forced to register or has a prior sexual offense conviction. So those that are not for profit are more likely to admit someone that is forced to register. So I actually had a conversation with a long-term care facility administrator. His name is Mark. He is an administrator of a not-for-profit facility in Illinois. And he was telling me about this story about a gentleman who came to him who was needing long-term care. And he found out doing a background check that he had a prior sexual harm conviction. So he wanted to sit down with the family and talk about that. Like, what did that look like? And he found out that this gentleman was 20. By this time, let me just say that this gentleman was also in his 80s. So he was 20, and his wife at the time was 17. They eloped. They wanted to get married. Her parents weren't happy about that, so they decided to elope. And the family actually turned him in to law enforcement, and he was charged with criminal confinement, kidnapping, and statutory rape of a minor. And they had been married for like 60 some odd years by this time. And so Mark said, obviously, this gentleman is not a risk to my nursing home facility and community, and we're going to allow this person to live out their last days in dignity and respect. And, he admitted him. So, but it's stories like that a lot of these nursing home facilities don't get to hear because they don't ask the questions. They don't want to know why. They just see it come through on their background check that they're either on the registry or that they have a prior sexual harm conviction. And they don't ask the questions. They don't take this holistic approach to find out, the story behind that applicant. But they also have their own, biases and attitudes and perceptions that they receive from media, that they receive from other stories that are untrue, false about this particular group of individuals. So the majority of long-term care facility administrators that I spoke with, they actually would, if their hands weren't tied, they would actually make admission exceptions. And they would do just like Mark did. And they would hear stories, find out, their past, and based their admission decisions on looking at the individual holistically, instead of just taking what comes back on a background check and just saying they're out. We're denying their application. So a lot of them would make admissions exceptions. A lot of them are not in favor of their company policy of not admitting someone that is forced to register. So some of them also reported that they have this perception that because they may be close to a park or their facility may be close to a daycare or a school, that obviously we must always say no to this individual. So they're basing some of their admission decisions based on these myths and what they believe that they can say yes or no to. The conversation always comes up when I'm talking with facility administrators about mitigating risk. It's to them, they say that it's all about risk and mitigating risk, and so we just have to say no. But they don't really understand, they don't even know what they're saying yes or no to, right? Because they think that, just like Janice was saying, and I think Ann and Amber all say it, and then I get to say it again, is that, they're believing that these individuals' reoffense rates are very high, like this says, that it's frightening and high, when we know that that's not true. They actually have the lowest reoffending rates among any homogeneous group of offenders, and people are surprised by that. they're surprised by evidence because they just think about what they've heard, what they've seen, what they, hear in media, or, read in a Psychology Today article that talks about statistics being frightening and high. So education is key. I know Amber talked about that with education, and this is no different. Being able to educate our medical community on really the true story about these individuals are not just going to come into the nursing home and start engaging in sexual misconduct. There was a GAO study in 2005 that looked at 8 different states, and they were kind of analyzing admission behaviors. They were wanting to know how many individuals that were living in nursing homes across the United States were forced to register, and the number was quite small. I think it was 0.05% of the nursing home population had an individual that was either forced to register or had a prior sexual harm conviction. We say that it's small, but it's small because they're not admitting them, right? Like the number, it's just not a true number because they're not admitting them. So even though they're saying that it's a small proportion of people relative to the nursing home population, we also know that they're not admitting them either. Which also tells us that when nursing homes have to report to the State Department of Health on sexual misconduct that's happening in the nursing homes, it's not coming from people who are on the registry or have a prior sexual harm conviction. They're coming from, an individual that's a resident who probably has dementia or Alzheimer's, and they become, by nature of their disease, hypersexual anyway, and they act out inappropriately. So, what's that?
That was going to be my first question to you. I too worked in the medical.
Okay. Well, so I just answered that for you. Yeah. Yeah. So, is you're right. So, so it's not happening, right? Because they're not letting them in to begin with, or a very small proportion of individuals that are living in our nursing homes are forced to register and living with a prior sexual harm conviction. So being able to educate nursing home facilities, hopefully to be able to change business practices, because it doesn't matter that these 12 states have legislation on the books. It doesn't matter because they're not letting them in anyway. I'm not good at math. I know I do statistics, but I'm not good at math. So 50 minus 12, whatever number that is, 38. Okay, 38. I have a Ph.D. in criminology, not math, but so 38 other states that don't have legislation on the books, they're still not admitting individuals either, because it's the business practices of the facilities that are the ones saying, this is what we'll accept and this is what we won't accept. So I know John and I, we wrote a white paper or whatever we did last week. John wrote it. He just was kind enough to put my name on it too. But so Florida Action Committee was trying to send some letters out to change some legislation, add some legislation about individuals being able to petition to come off the registry as it pertains to long-term care admissions. But like I told John, I think that's a great step, right? To petition to, at some point, being able to come off the registry. But as it relates to long-term care, it doesn't matter, because they're gonna pull your criminal background check, and even if you're not on the registry, but they see that you've had a prior sexual harm conviction, they're still going to deny you anyway. So changing business practices is key and essential. And then I believe it was the state of Iowa. They did raise Medicaid reimbursement amounts for healthcare facilities that care for those with a sexual harm conviction. In 2023, that law did pass, that the Iowa Department of Health and Human Services had to come up with a formula to raise the Medicaid reimbursement amounts for nursing homes that establish a separate unit for individuals with a prior sexual harm conviction. I don't even want them to be separated. I want them to be able to, be in general population. Like, I don't think that they should be separated. There is some legislation that says that if they do admit them, they have to be, up front by a nursing station so that they can monitor them, or that they have to be in a room by themselves. And so, I want them to be able to not be segregated and not be separate. In Georgia, their legislative body did allow people on the registry to petition for removal from the registry once they needed long-term care, and to make residency restrictions no longer applicable. So there have been some successes, some small successes. But again, I think both Janice and Amber, and maybe Ann too, talked about that this is a public health issue. So there's a publication, myself, and if anybody's familiar with Dr. Jill Levinson, she was my co-author on a paper that will be published sometime here in 2025 in the Criminal Justice Policy and Review, where we actually were looking at criminal justice policies through a public health lens. And we could say that some of these criminal justice responses to crime, these legislative language in long-term care facility, that it mimics what you'd see even in a public health context. So, we believe that denying access to long-term care for people convicted of sexual harm really does create a public health issue. It really reflects challenges around human rights, around medical ethics, and social justice. The health needs of the aging population for people forced to register or living with a prior sexual harm conviction is a reality that needs to be confronted in a fair, humane, and ethical way. We also know that the risk of reoffending declines significantly with age. We also know that time spent offense-free in the community matters, and the elderly and the infirmed are highly unlikely to sexually reoffend. And so, we really need to take risks that must be balanced with the human needs for care for all elderly persons, and including those that are forced to register with a sexual harm conviction. And having lifetime registry makes the admission for those seeking long-term care nearly impossible. So those are some of the things that I have tackled, that I'm committed to doing. I'm only one person, but I sure do try to make this topic well known, and hopefully we can make some changes in the future. And like I said, I think everybody should have access to medical treatment and live out the rest of their life with dignity and respect. Yes. Thank you. Yeah.
What about, you
Oh.
mentioned the VA.
Yes.
What about the fact that VA hospitals are not allowed to let that affect your medical treatment? It's not allowed to be on your record, and they're not allowed to ask you anything about it, etc. How is there, obviously somebody won there. Why can't that be generalized to
the rest of the long-term care facilities? I think that's right. No, I think that's a good question, and she was asking about how the Department of Veteran Affairs in their long-term care facilities that they admit individuals with, that,
No, I'm talking about if you.
oh, sorry.
If a veteran seeks treatment at a VA hospital, it isn't on their record and it doesn't come up, they're not allowed to treat you any differently. If they should find out if you admit, self-admit, or somebody challenged or whatever.
But they still are receiving
That's right,
treatment.
That's on the internet, anybody can look it up when you look up.
Well, and we don't ask, like, when you go to the hospital, we're not asking, right? You get treatment.
And these are our veterans, and why can this not be generalized
To everybody.
to the long-term facility?
Yeah, I mean, I think that's a good question. I think it's a good debate, and I don't have an answer for that, but yeah, yeah. But I think that's good.
I just have that question.
Yeah, for sure. And John was a veteran, and unfortunately, we couldn't find a veteran long-term care facility for him before he died. Anyway. Yeah. Okay. Sorry.
Yes. As you've done your research, have you found that the insurance industry has put any pressure on them for not admitting or raising of rates?
So that's a good question also. In May, I'm actually working with the state of Nebraska since December. We're doing some webinars with them in May. But actually, one of the ladies in the Long-Term Care Association in Nebraska said that there's a question for the nursing homes, like when they're seeking to be insured, that they ask that question about, do you admit someone with a prior sexual harm conviction? And we're trying to find out the answer of, like, okay, if you say yes that you do, like, how does that then affect their ability as a nursing home to be insured? Does it, increase their rate? Do they not even, get accepted with that insurance? That I don't know yet. But I don't think that the insurance companies are necessarily putting pressure for them to admit them. I would actually think it would be the other way around. Yeah. Okay.
Dr. Jerstad.
Yes.
I'm Jeff from California.
Yes.
You and I have
Yes.
emailed back and forth.
We have.
And I'm inspired by you. I know you did a parcel in a war seminar, and I've done a lot of investigation out of San Diego, unbelievably, and I found 4 different things. I just have a...
Yes, I would like for you to say them.
One is, I found these 4 things because I've looked at a lot of people. I'm going to be there soon myself if I'm not there now. Individuals that have become disabled, use a walker, and sometimes just need help. And they're with family in California. They're with board and care facilities, sober living, and homeless. Now, one of the things you mentioned, I didn't hear here, is in California, they have to post it in the nursing home or assisted living facility, correct?
So not only do they have to post, they have to notify. So that's the term that I was talking about earlier, some of this language. They have to notify residents, staff, and visitors that someone in the home that's living there is either forced to register or has a prior sexual harm conviction. They don't say who that person is. They just say that someone is living with this on their record.
Yeah, well, I found that they live with families, they live in a board and care facility, they live in sober living homes, or they're homeless, basically, because it's very difficult to find in the state of California an individual to locate assisted living. And even then, they may not care about it. The board and care facility is basically a home that helps elderly. And the minimum I found was $2,500, the absolute minimum, and I was able to place an individual on the registry in a home up in Temecula as a result of that. Also, what I plan on doing is having somebody, it sounds kind of strange, I can't look on the Marcy's Law site in California, but I'm going to have somebody try to locate assisted living facilities, possibly nonprofits in the state of California, and make them aware of somehow that they are that these are available to them, so places that could. I guess my question to you is, what organizations, public organizations that assist individuals, elderly, might be might be helpful to notify, in this case, that these facilities might be available to them, if you follow me.
Yeah, and I think that's a good question also, Jeff. And that was one of the things that, because we don't necessarily know the magnitude of who this involves, and we don't know state by state, which would be a goal of mine, to know like what facilities are allowing individuals into their care and what facilities are not. So we don't have that answer, unfortunately. Yeah. Oh, sorry, yes.
Hi. You can hear me?
Yeah,
No, okay.
I think so.
So most of you folks here in this room know that I'm the travel guy. But what you don't know, most of you, is that I am also embarked on a whole different project, which is I'm actually trying to start a assisted living facility, long-term care facility, in the exceptionally challenging environment of Tallahassee, Florida, to start a facility that will accept, as a matter of policy, registered people like myself. And I'm doing this so that I can have long-term care when I need it. So I'm doing that. I have already purchased the building where it's going to go. And I am at the point of doing a nationwide solicitation for a provider of goodwill to occupy that space. And so you all will start seeing in your NARSOL digest in the coming months, and in the NARSOL conference brochure, my solicitation advertisements that'll be coming up, where I need to get my name out there to see if there is a provider of goodwill ready to come and start this facility so that I can have this type of care. I did want to say, you mentioned about insurance. I have personally been denied, there's a type of insurance, life insurance with a long-term care rider. I have been personally denied it by every insurance company that my insurance agent contacted because of my registered status. And so the fact of insurance and how you're going to pay for this type of stuff is also an issue that really needs to get addressed.
Mm-hmm. Thank you. Thank you. And
Hey, Stephanie.
Yeah.
I just wanted to say, I do have a quick question, but mainly people like you who don't have like a loved one on the registry and choose to devote their like job to us deserve just extra love. So let's all give her a little extra love.
thank you.
It's a really big deal, and we really appreciate that. The other thing that just came to mind is like, so if you have a past conviction for theft, why is no one worried about you stealing all the things in the nursing home?
Well, it's interesting that you say that, because let me just address that real quick. In Illinois, the Illinois Nursing Home Care Act, so, I know that I just talked about, one group of individuals, but if you have check embezzlement on your record, if you have anything that has to do with money, fraud, bad check writing, those are also offenses that you may or may not be admitted into a nursing home. Domestic violence, if you have domestic violence on your record. So in the Illinois, at least in the Illinois Act, it's not just this population and individuals that we're addressing today, but others as well. Yeah.
You would think in this great nation you'd have the dignity to die.
Exactly. And that's the other thing too, is that, John died while we were waiting to try to find him, nursing home care. So then that brings up the question of mortality and morbidity, right? Like, these individuals aren't getting the care that they need, or subpar care, if at all. And so how is that speeding up their mortality and morbidity? And that would be another area of research that I would love to definitely go down that path.
I do have another question.
Okay.
Want to get me on?
Yeah, yes, I'm sorry, yes.
When my mother needed long-term care, I was talked to extensively by a consultant about this, that she could also stay in the home and receive, I don't know if they came under Medi-Cal or whatever, what other government payouts, but could that be something, or would their status also keep them from receiving that?
Right, so home health care. Yeah, so I don't find it as often that they reject the applicant because they are being in their own home. So typically what they do is devise a safety plan for the caregiver or the nursing provider that's coming into the home. So it's more so when you're needing to be residing in a long-term care facility versus getting treatment in your home. Yeah. All right. Exactly. Yeah, we would not want that. Yeah. Yes. Oh, sorry. Wait. Oh, wait.
Everyone's got microphones.
Okay.
I'm wondering if you have any information or data or research, or maybe somebody else has information, data, and research about visitation prohibition issues, in the same sense that schools and religious institutions are having all these prohibitions, because my mom is about to go into a nursing home facility, and I have a lot of concerns that visitation is going to be an issue.
To my knowledge, there are no visitation prohibitions, but that doesn't mean that there aren't. I just not have come across that there are. Yeah. Yes.
So in New York State, for example, car insurance rates are determined by actuarial statistics, and by law. And car insurance rates can't be raised more than what accident statistics would show.
Okay.
Are there no actuarial statistics done for what actually happens with a sex offender or a person on the registry to what they actually do? Given that, I'm sure I would really bet my life savings on the fact that an 80-year-old who's in a nursing home, incapacitated, is not reoffending.
Right.
So,
Right. Yeah. They're not looking at that in that way. Yeah, they're just looking at what they think that they know, and so we create these business practices and policies, procedures based on anecdotal evidence that's inaccurate and untrue. Yeah. Okay.
I was wondering if anyone has had trouble getting health insurance. My son seems to be having a hard time getting any kind of Medicaid or even the Obamacare. I was just wondering if anyone had any plans for that.
I do not, but does anybody else have any? Any?
He's in Kentucky right now.
With Obamacare? I've had that for 5 years. Never had a problem.
Okay, maybe it's the way he's doing it then. So I should. Okay, thank you.
I had an insurance company cancel my car.
That's who I have. Uh-oh. Who else had a question?
Well, I just want to address the one thing about visiting an elderly person. I know that some years back, when we went to pick up our granddaughter at a school, we had to scan her ID, and it does an instant background check. And our church also rotates visitation at a nursing home, and this particular nursing home that we visit, it has the same concept. You have to put your ID in, and it scans an instant background check to allow that person to go visit. Now, I don't know if it's going to background check as much as the school did. I really don't know, but I just wanted to look at that.
Interesting, yeah.
But I have a question as well. You mentioned that as a subgroup, that those who have been convicted of those that have a sexual harm conviction, I wrote down the words, are the group least likely to reoffend.
Mm-hmm.
Do you have a study on that, and where could I find that?
I can get, there's plenty of studies on that. So yeah, and I could get it to Janice, or you can just give it to, like
I
your
find
thing.
so many different studies, and some are dated 2010, some are dated 2012. I'm trying to even find for Arizona what the reoffense rate is, and the latest I can even find for Arizona is 2010. And I thought, well, I want to know what it is currently.
Yeah,
not what it
currently.
was in
They usually are 2 years behind. So whenever you're looking at data, it's typically 2 years behind. But we have the general statistics that, across the United States, looking at it at a macro level, that really the reoffending rates is anywhere from 5 to maybe 15%, but it's typically on that lower side. So, you could generalize to the state to say that, the reoffending rates, I know Janice said California is at 1%. So it's going to be very minimal. Like our property offenders, people who, offend against property, their reoffending rates are the highest at 70%. They are frightening and high. Exactly. Yep. Okay, is that it?
I just wanted to make a quick comment on
Who's
the
talking?
insurance.
Oh, yes.
Our organization, Axol, when we applied for D&O insurance, directors and officers insurance, we were turned down.
It's not true. I'm sorry, Craig, it's not true. We got D&O insurance, we couldn't get general liability insurance.
Well, no, that first company that we went to, they wouldn't insure for either.
Okay, we have D&O insurance.
Yeah, we got it.
We don't have general liability insurance.
Okay. Amber.
Thank you so much for your presentation and all your work. I have a couple of things just to mention. So the system that the young lady over here was talking about that checks when people go into a school is called Raptor.
Raptor.
And
Okay.
it does not do a background check. It does a check of the registry. So you can have any other conviction.
Interesting.
And
Raptor.
that is also starting to be implemented in nursing homes as well. And a lot of youth serving organizations, so on and so forth. But I want to draw people's attention to an organization called Worth Rises that does a lot of research and work about the prison industrial complex and people sort of benefiting off of these systems and things like that. They're doing a lot of work around different things like that. And so the thing is that there is an active campaign by this company to sell this thing to schools and all these other organizations selling safety where it doesn't exist. So I just wanted to mention that. And then I did have a question for you, Stephanie. I know that when we work with people, and in my own experience trying to help someone, particularly in Florida, find nursing home care, it gets very, very discouraging. And so your presentation says that. But what I found is having the support and never giving up, right? So you mentioned 212, you called 212
Right.
things, but have you found that the smaller, assisted livings or smaller placements that may have 10 people, or they're privately owned by one owner that you can reason with, have been more successful? Because that's what I've anecdotally seen.
Yeah. So I did make some of those hypotheses because you're trying to, if you think about it, you're thinking, okay, maybe facilities that have a lower occupancy rate will be more likely to admit, or does facility size matter in terms of number of beds? But we didn't find that any of that matters. It was really just ownership that mattered the most. So those facility level characteristics only mattered when it was for-profit or not-for-profit. Yeah. Yep, you're welcome.
So I'll just add something. What was the name that you called the system?
Raptor.
Raptor. Another one they have now is called Cobra. And they use that in Florida, and that is, and it's honestly, they have them at children's hospitals, regular hospitals now. I just had my latest child, And I get there, boom, 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 and I'm worried about it because, like, crap. And they have to take my ID, and she goes, oh, no, we have a problem. And already I'm like, all right, time to start fighting. I mean, I won't go down without a fight. And she goes, oh, okay, I got it cleared up. You just weren't assigned to a room. Yeah, I'm like, ooh, let me put my boxing gloves away. But it didn't happen in the children's hospital. I had to fight them, threaten to sue them. But they still let me in. Just remember, stick up for your rights, because there is nothing that prevents them by law, at least in Florida, that says you can't go do that. It's their policy. So there's always a way to get past policy if you can maneuver. Does anybody else have any other questions?
Thank you.
Please, everybody give Stephanie a round of applause. That was really good.
So folks, I know we've had some great speakers today, and maybe not everybody was taking copious notes and might want to hear these presentations again. They're all being recorded. Okay, they're all being recorded. It's not being live streamed, it's being recorded. And so multiple organizations will be able to post them up on our websites and everything, so you can watch them again. And of course, people who didn't get here, didn't make it for one reason or another. Some of them didn't even sign up. The fact is that all the presentations will be available. I have no idea. Well, check. Are we going to have written transcripts, or is it just the audio and video? Yeah. Okay, maybe, perhaps. Hey, that's the best answer lawyers always use, perhaps.
We'll see.
Yeah.
We'll see.
Well, folks, we do have a little bit of time here before the next group starts. We have about 13 minutes according to my calculation. So why don't we just throw it open if anybody has a question, comment about something, and here it comes.
I just wanted to say thank you to Chuck and to Roger for all the hard work they've done behind the scenes, all the equipment they're dragging around, and all the things they're testing. The number of things that Chuck, I know, has been doing in the last 3 weeks is a lot, and no one was probably going to thank him for it. So thank you, Chuck. I love you.
Yeah, it's all that behind the scenes stuff. So I know that Roger and I were in this very room until 11 o'clock last night, stuffing in your little envelopes with our names on it. I was like, uh-oh, we forgot to do that. So, and we're fine with it. We really are. And so, and again, for those of you who weren't here at the very beginning, this in some respects is a dress rehearsal. Okay, we expect to be bigger and better next year. Okay, this is a good opportunity for us all to come together and to share information with organizations to show that we can in fact work effectively together, because guess what, this is a really controversial issue. Anybody figure that out yet? And we all have different approaches. Okay, we really do. And so some of us are litigators, some of us believe in the legislative process, some of us don't. It's okay. We're going to get to that tipping point. We just don't know quite where it is yet. Yes, sir.
So as him this, it sounds like our snowball is building and building.
Yeah.
Why are we at this point now, and why weren't we here like 5 years ago, 10 years ago? It's kind of an open-ended question. I'm just curious why you think it took, like why right now, I guess is the question.
Well, what I see, it's just my personal opinion, as we have more organizations now than we've ever had. And we're all seeing things from a slightly different perspective. And so, if you all know about the parable of the blind people and the elephant, right? And in the beginning, it's like, oh, yeah, it feels like a snake. That's the trunk, right? Oh, no, it feels like a tree trunk, the legs. The tail, it feels like a broom. So we were just coming at things from a different perspective, and different states have different challenges. I mean, really, in California, we've gotten rid of presence restrictions and residency restrictions on Halloween signs, and we're making our way up the ladder here, right? And so that's not an issue in California, but I know in many states it is an issue. And, the nursing home thing, and I just recently, tripped across Stephanie, and I'm really glad that I did, because we have that issue in California, and yet I had no idea what to do about it, right? And I'm not sure I still do. Another issue has to do with churches, by the way. It really pisses me off, quite frankly, that any church would say no to registrant coming to service. Maybe you don't want to be a Sunday school teacher if the victim was under 18 and it was 3 years ago, but what the heck? I'm a Christian. I believe that first principle of Christianity is redemption. So what the heck, right? You shouldn't let everybody in your damn church. And so right now, I'm trying to figure out, and so a lot of the churches are starting to blame their insurance companies. Well, it would be okay with us, but the insurance company says no. So what am I trying to do? Figure out, am I going to sue the church first or the insurance company? The answer is probably both of them. Okay, so, but you know, we approach these things from different issues, and I don't want people to despair. We are getting more accomplished than we ever had. The other side is doing their thing too, right? They're getting nasty and stuff, but it's okay because we have truth on our side, right? We really do. So this 80% frightening high is bullshit, right? And we just need to get the U.S. Supreme Court and everybody else to listen to it. It's bullshit. And Jill Levinson, who has been cited a couple times already, and other people, other academics, are doing all kinds of research, and they're finding out that registries are not effective. So like if you're in a meeting with the legislator or the staff and they go, well, you know, the registry is solving the problem. I'm going, absolutely, actually it's not. Let me tell you about this, right? And so to have a dialogue, and also, and one person has said a long time ago about framing the issue and say, yeah, we agree with you, sexual abuse is bad. How are we going to stop it? Okay, the registry is not effective in stopping sexual abuse. So what else? You know, prevention is right. You know, loving. I loved your presentation. I'm sorry, Anne. Thank you. I can remember your last name. So anyway, it was great. I mean, just love people who are on the registry. If they haven't been loved, and you're going to basically unlove them some more, what kind of result do you expect, right? And so it's just going to take some time. And again, if we only had the map, and we knew where the tipping point was, right, we'd be there tomorrow. So just hang in there with us. And I know you're a young person, you're probably not very patient. It's okay. It's one of those things we acquire as we mature, more patience. I'm still not as patient as I could be. There's a question over there.
Well, I want to add one thing real quick to the first question. Who here went to a conference 5 years ago?
Yeah.
Who's this first time coming to a conference? That's the snowflake effect right there. I think one of the things and the reason why our movement is growing so much is because of the other side. I mean, 5 years ago, we didn't have some of these nasty laws that are coming out now, especially in Florida. You had small pockets, but now it's like wildfires, cancer, and technology. 5 years ago, people were getting blasted on Facebook and all this crazy stuff. The tech world, I don't think, was there yet. Today, every day, someone's publicly being shamed, which basically puts us out whether we want to or not. So once you're out there in your public, now I have no reason to hide in the corner anymore. And I think that I think those tactics are actually helping our movement grow because people are feeling more empowered because we're being forced. The gun's against our head, what do we do? So.
Right. And somebody like Frank, if I could tell another part of Frank's story, I mean, somebody broke into his house and tried to kill him in his own home and said, you blankety blank sex offender, I'm here to kill you. There was no ambiguity why he was there, all right? And the man was a victim of sexual abuse. He was very angry. He was very disturbed, et cetera, et cetera. Well, you know, Frank, you've told me, Frank and I are friends. He's my former plumber. We've remained friends all this time. And the fact is that the young man he was angry. He wanted to take it out on somebody, right? And the question is, what do you do with that person? What do you do with Frank? And Frank, and part of the story is he reached out to the person who tried to kill him and to send him love. I mean, the man ended up in prison, by the way. But even having said that, our district attorney refused to acknowledge that the reason that the man broke into his home and tried to kill him was because he was on the registry. But he was caught with a machete at a convenience store. Okay, and Frank was the second registrant he tried to attack that day. The first one had a chain on his door. When he opened it and looked at the guy and saw that he looked crazy, he shut the door and locked it. Okay, but Frank for many years hid. He hid. Frank is not hiding anymore, and when it came time to litigate, guess what? Frank was my plaintiff in, I don't know, countless, probably 25 lawsuits, right? and it was hilarious because a lot of them had to do with presence restrictions. or residency restrictions. And so the opposing counsel started getting, well, wait a minute, you said Frank wanted to move this place, and now you're saying he wants to move that place. Oh yeah, he wants to move all those places. That's right, because Frank's been in the same house for more than 20 years. But yeah, he really wants to move out in the middle of the desert. He lives near the Pacific Ocean. So yeah, it's okay. I mean, but we always have to evolve at our own speed, right? And so just leave it at that. And did you have a question? Okay.
Yes. I'd like to come back momentarily to the religion. I kind of zoomed by that, but that's a bit of an issue, and especially you as a civil rights attorney may want to address or talk about it. You can't really sue what's happening in Connecticut, but it may be the case in other states. I don't know if you would let it go by in California. Small state like Connecticut, we're not lucky enough to have attorneys participating on our organizations. They haven't come forward yet. In Connecticut, the general practice is probation, not the churches. Probation tells you may not go to church.
Oh, that's a great lawsuit. The government cannot tell you you can't go to church.
Well, I always thought so, but
it's true.
away with it.
Call me after the conference is over. And just in case you wonder, I'm only licensed to practice law in California, but if I can file a case in federal district court, and then I go find myself a criminal defense attorney who will be my local sponsor, I can file a lawsuit in any federal court. Yes, Chris?
Up to know.
3 minutes. That's what that. Well, at least you just didn't use one finger there. Yes, ma'am, I know you've been waiting.
HOAs, have you ever had any cases where HOAs are refusing a register from purchasing a home?
Not from purchasing a home, but living there. Yeah. Okay, so they can, in fact, they can in fact tell you you can't live there. They make it like an exclusion and stuff. So private parties can do things that the government cannot. That's why when Brian, I think his first name is Brian, when he was telling me that they're like, holy shit, that's a government, man, I can sue them, right? But an HOA, no. It's just like the same thing with Packingham case where I talked about social media access. So the government cannot prohibit you from accessing social media, okay? But they can't, but Facebook can. Facebook can have a policy that says nobody who's been convicted of a sex offense. I hope you all know that. On Facebook, they will take down your page. Something one person has to do is rat you out, and they will pull the plug on your Facebook page without warning. Even people who are no longer required to register. Here's another thing. What was that? It's private company, right. So the government, so when it comes up in a parole condition, I go, no, you can't be doing that. One other thing I want to say, because I said at another conference and everybody was gasping. If you are under the federal system and you have, quote, a lifetime supervised release, it's not lifetime. Okay, it is not lifetime. You can petition to get off of supervised release, which is AKA probation, under the federal system earlier. Talk to me.
All right, everybody. Just because of the sake of time, we do have to stop it real quick so everybody gets a break. At 2 o'clock, we're coming back with Janelle and Shine Voices and Joe with Pathfinder. So everyone grab some illegal substances over there before they go away. Hit the bathroom, and we'll come back at 2.